Alright, to insert and remove an NG tube on a patient, the first thing you want to do when you come in the room is perform AIDIT, do your checks and rights, proper hand hygiene. I wouldn't have gloves on yet. And then you can raise the patient into a high Fowler's position. And at that point, you'll be ready to gather your supplies, which consist of tape, the tubing, the Salem sump, gloves, which I do not have on yet. You might want a pad to place over the chest and a cup of water. And at that point, you'll be ready to measure the tubing. You can get the tubing, which I've already opened and everything. And you'll measure from the tip of the nose to the earlobe and down to the xiphoid process down here. And at that point, when you have it on your patient, a lot better than I'm doing right now, tape it at the end of the nose to measure. And after you've done that, you can lube the tip of the tubing with lubricant to make it go down easier. And you can then don your gloves, which I would now have on. Tell the patient might not feel the best. You might have some discomfort. And remember, while you're inserting it, if they start to choke or gag or anything like that, stop and try to redo it. And then I am right-handed, so I'll be on the right side. If you're left-handed, be on the left side. And you would start to insert it and kind of curve down until you feel some resistance. And once you feel some resistance, you then can tell them to point their head down and give them the water, or they should already have it. And then every time they take a big gulp, you insert it further and further down until you reach the tape. And once you reach the tape, you can then affix the end of the tubing towards coming out the nose onto the nose, and affix some other part of the tubing to their gown or some part of their clothing. And then once you've done that and everything looks good, you can then take off your gloves, perform proper hand hygiene, give the patient the call light, put them in that same position or in a comfortable position. And at that point, you're good to leave them there and go out of the room. Then when it's time to remove the NG tube, come back into the room, perform AIDIT, checks and rights, all that good stuff, put them back up into the Fowlers, and then you're ready to gather your supplies again, which this time consists of the same chest pad, the protective layer, syringe, gloves, some more water if they need it, and gauze. And you first can start off by taking whatever you have affixed to the clothing or gown off, and what you have affixed to the nose off. And then you can take the syringe, fill it with 10 milliliters of air, and then you would push the 10 milliliters of air into the tubing. Then you can don your gloves you have, place the gauze by the nose so nothing drips, anywhere all over their face. Tell them it might not be the most comfortable thing ever. They're probably going to feel some discomfort. Inform them of what's about to happen. You can then take the tubing, and kind of like how you take out a catheter, it's kind of the same. Wrap your fingers around it, kind of gently, and then after you've got it out, make sure there's nothing has dripped anywhere that you don't want stuff to be. You can dispose of everything you need to dispose of, document everything you need to document, take off your gloves, proper hand hygiene, which should come first before documenting. Give them a tissue if they need it, give them the water if they want it, place a call light next to them, place them in a comfortable position, think that's it. That's how to insert and remove an NG tube.